Hello, I'm Dr. Alex Samuel, the Health Director for the Chesterfield Health District, which includes Chesterfield County, Powhatan County, and the City of Colonial Heights. These are very interesting times. As I speak, the number of COVID-19 cases in the United States, the Commonwealth of Virginia, and this health district are increasing. In several Virginia communities, we're seeing positive COVID-19 cases that we can't link to specific sources. In other words, some people are catching the virus and they do not know where they're catching it from. When this happens, public health officials say that community spread is taking place. Community spread of the virus does not respect health district boundaries. This means that special precautions should be taken to prevent the spread of the virus in our own community. Since we don't currently have a vaccine to protect against contracting COVID-19, the most important thing citizens should be doing is practicing social distancing, which means taking steps to reduce the amount of contact an individual has with others. Social distancing will slow the spread of an infectious disease like COVID-19. Many social distancing measures have been enacted, like closing K-12 schools and businesses as well as government instituting telework practices. The goal again is to keep people who are ill away from people who are well in order to slow the spread of the COVID-19 outbreak. You might be aware of several social distancing steps the governor has recently asked Virginians to take, which include avoiding non-essential public gatherings of more than 10 people. Individuals with chronic conditions or age 65 or older should self-quarantine, but should stay in regular touch with friends and neighbors. Having restaurants, fitness centers, and theaters limit their capacity to 10 patrons. Social distancing has been used in previous outbreaks and has been proven as a method to slow the spread of infectious diseases like COVID-19. It is crucial that we take these steps to prevent the virus from spreading to the most vulnerable members of society, which includes those who are elderly and those with underlying chronic conditions like heart disease, diabetes, lung disease, or compromised immune systems. All of these social distancing steps should be practiced. However, I want to point out a few things in particular. First, stay home if you're sick. Second, if you have been notified by the health department or your doctor to remain home for 14 days because you've been in contact with somebody who tested positive for coronavirus, it's very important that you do so to avoid spreading the virus. This is true regardless of if you become symptomatic. Third, remember to practice basic hygiene protocols, such as washing your hands often for 20 seconds at a time, covering your nose and mouth with a tissue, or your elbow, or even your upper sleeve when you cough or sneeze. Avoid touching your eyes, nose, and mouth. And please continue to visit the websites of the Virginia Department of Health or the Centers for Disease Control and Prevention for new and updated information, which is constantly being added as this rapidly changing situation evolves. Thank you in advance for practicing social distancing to keep both you and the vulnerable members of our community safe. Your efforts will protect others. Thank you for watching.